So good afternoon. It's Monday the 11th of May and my name's Wendy Randall. I'm one of the consultant midwives. I have been doing these sessions every week to hopefully answer some of the questions that you may have. We've had an amazing week the last week. Thank you for helping us celebrate International Day of the Midwife last Tuesday even. It was a great event. We tried what we could under the restrictions that we currently have. We were spoiled with kind messages from people. We were fed again. So everything's getting a little bit chubbier. So lots of nice food and cake and some nice parcels from the Royal College of Midwives. Face masks and hand creams and bits and pieces to help look after us, so thank you for that. And I think staff generally feel very valued by everybody and really appreciate your support. What else happened last week? We started our new induction of labour pathway, which I talked to you about last Monday. So that's off to a good start. We're still doing lots of training and supporting people so women can choose to have the mechanical induction, which is a much more gentler way of inducing a labour, or they can choose to have the Prostin gel. So we have a patient information leaflet for women. And also, excitingly, we were able to offer outpatient induction, which means that women could come in, not all women, but some women could come in, have their catheter and go home. To spend the evening with their family before returning back. And we've been fortunate enough to have people going into labour without needing us to do an awful lot more to them. So been a very exciting week. So there has to be some benefits out of what happens with COVID. Hannah, thank you for your message. I'm glad that you had such a positive experience by both community and hospital midwives. I think, we're generally all very positive about, looking after you, and we want to make sure that people still come forward if they have any concerns and don't avoid coming to hospital, because there are some people that need to come to hospital and it's important we identify them. So please don't be put off. We are all happy and smiling and can't wait to be able to look after you. And Yvonne, thank you very much for your message and for giving a care package to the Horton yesterday. I'm sure the staff appreciate it. We have been overwhelmed with how kind people are being to us, and hopefully we are being very kind to them too. So what else? Today I was going to talk to you about the changes that have happened in terms of testing. So from today, we are offering swab tests for all women who are going to be in hospital to stay. So before it was just women who were going to be admitted onto level 6, which is our antenatal ward. But from today, it is every woman that comes in labour, only in the John Radcliffe Hospital, but whether she is going to give birth in the delivery suite or the Spires, you will be offered a swab test for COVID when you come in. It's a throat and nose swab. It's a little bit uncomfortable to have done, but we are offering this testing to everyone. If you're readmitted after the baby's been born into hospital again, we would do the testing. So we have a patient information leaflet that we're currently working on with Maternity Voices Partnership. And hopefully we'll have that available for you later this afternoon. Everything that's happening during COVID times has to happen so quickly, which is why sometimes the swabs are up and being used before we're actually ready with our information leaflet. But hopefully, like I said, that will be with you today to answer your questions. In terms of getting the results, we have different people, the maternity assessment unit will follow up on some samples, as will level 5, as will community midwives. Because we appreciate there's about a 48-hour window before you get results, you may have had your baby and gone home before you get your result. but we will get those results to you. So if you haven't had your results, please do encourage any conversations with the midwives to enable us to get that result to you. So Jess, you've asked, will partners be swabbed too? Jess, not in this next phase, so partners won't be swabbed, but hopefully, you'll find the advantage of being swabbed yourself, because if you did have a positive result, it would help you to be able to know how to look after your children, your baby. So Maisie, you've asked, does the test only work when you have symptoms? No, Maisie, the test is to identify people who perhaps their symptoms are very mild and they don't realise they have symptoms, or there are a proportion of the population who are asymptomatic, which means they don't have symptoms but they still carry the virus. So it's important for us to be able to see who has those symptoms and use it to inform how many people are out there that are actually positive. So Jess, again, you've asked, will partners be tested too? Not at this time. Sian, you said, is it something you'd want us to come in to have done before we go into labour? No, Sian, we're just going to do it when you come in to have your baby. So you don't have to worry about coming to the hospital beforehand, but we will do it when you come in to have your baby. And Yvonne, you're asking, will babies be swabbed? No, that's not our plan at the minute. So we know that there's still so much uncertainty over COVID and what's going to happen, and we're trying to share everything as and when it develops. But hopefully, like I said, there'll be more information coming today about the testing. And so, encourage people to look at the Maternity Voices Partnership Facebook page, because that's where a lot of information is getting posted much quicker than perhaps our maternity website. But again, we're trying to get it up there as quickly as we can from that perspective. So I'm just trying to share, is there anything else that's happening within the unit? We have seen an increase in births in our midwifery-led units over the last few months, which is absolutely amazing. It's great, it's really appropriate for, when women are assessed as being low risk, for them to use our midwifery-led units. So we hope that that continues, and our staff have been working hard, even in their spare time, to produce films that we can share. So they're like virtual tours of the midwifery-led units. So I think there's a Spires tour that's either been shared or will be shared shortly, and I'm just working on the Horton midwifery-led unit one at present to try and get that up as soon as possible. That was by the great team up at the Horton. So it's amazing the skills midwives have, that they're producing these fantastic bits of film footage for you. So I think, again, there are lots of films available on our website to help you in terms of home birth or birthing and midwifery-led units, which I'm sorry, is my boring voice and face again, telling you all about it, but hopefully that will help you have the information that you need going forwards. So a few more questions. You said, Chloe, why wouldn't babies be swabbed? With their immune system being weaker, surely it'd be encouraged that babies do get swabbed. So Chloe, when babies are born, babies aren't at risk of coronavirus when they're born because they're in a sterile environment. So they aren't at risk. What happens is if you are infected, over time there is a risk of your baby becoming infected. So that's why it's really important for us to swab you primary, because then we would know whether there would be an issue with the baby or not. But there's absolutely no point in testing baby at birth, because the baby would not have any signs of coronavirus, because it is not passed on to the baby until afterwards. So Emma, you've said, is it still the case that we can have one birthing partner? Emma, of course, we absolutely want you to have one birthing partner. I'm afraid there was nothing new in terms of what the Prime Minister said yesterday in terms of us being able to relax that and increase the number of birth partners that you can have. So at present it is still one birthing partner, and that even people that are going back to work are people that are still essential workers, and people that can't work from home. So yes, it's just one birth partner, but absolutely they can be with you for the labour and birth of your baby. Gemma, you're saying, has there been many women that have not been able to use the pool due to the increase of women using the spires? Gemma, not to my knowledge. Sometimes it's a bit tight in terms of there might be somebody who's just given birth in the pool room when you come in. And so what we have to try and do is we encourage that person to leave the room and go to one of our postnatal rooms to have their shower and start feeding their baby, so that we can clean the room and get it ready for the next person coming through. But you know, sometimes we've had somebody in one of our side rooms waiting for a pool room, but generally we try to enable that to happen. And because we're able to triage you during the day, we also know what else is happening in the unit. So we might say to you, actually the spires, you know, it is quite busy just now. There might not be a pool. We might offer to women that would they rather go to the delivery suite if the pool is available there, or to go to one of our community midwifery led units, because then they could use a pool there if the pool is particularly important to you. But generally we've not had a problem. We are coping very well and managing the service so that women can get to use the pools. I'm sitting in the pool room just now. Don't know if you can see the pool beside me. So there is a woman in labour in the other room, but this pool room was available for us to use today. So hopefully that will reassure you that there is a pool room available. And if somebody came in that wanted this room, we would be moved out. So luckily we have the tablet and we can move away. So Kirsten, you said, what is the process if you decline an induction at the moment? So Kirsten, if you decline induction, because what we're doing is we're offering women to come in the day before their induction of labour to talk to them about the induction and hopefully start the process. Because the mechanical induction takes a little bit more time, because it's about gently urging, softening and stretching your cervix to encourage a more natural labour. So if you think that you'd like to decline the induction completely, we ask you to come in the day before your induction and you'd have a conversation with the midwife there. If it's during the week and I'm around, they might call me down to talk to you about it, what you want to do, and help you plan the next steps. Or it might be one of our doctors, or Emily, the other consultant midwife, might be one of us that come down to talk to you. And we're there to support women. We think women should make an informed choice, and thus hopefully we provide you with the information that you have to make the right choice for you and your family. But you must never feel forced into doing anything, ideally. So then we have Emma. You said, will our birth partner have to isolate before the birth? Your husband is still working. So, you know, I think it's really important. We try to encourage people to socially distance. We obviously can't make people isolate, because it's very important for people to go to work, and especially if they're in an essential service, which is why they would be working, for them to continue doing that. But it really is important to adopt social distancing. You know, as Boris Johnson said yesterday, it's really important for people, if they can, to avoid public transport and to try to think of other ways of getting to work, because it's about trying not to be in close space with a proportion of people. So yes, where possible, it would be ideal if your husband could self-isolate, but we appreciate people still have to go to work and it's important. So as long as they're very clear about the social distancing and applying those rules, then your partner should be fine. So Jade, you're saying, at what point, if at all, should I let the spires know I intend to birth there? I'm 36 plus 3 weeks pregnant. So Jade, it's always good to talk to your community midwife about it, just to make sure that that you meet the criteria for birthing on the spires. So with that, we're looking for a low-risk pregnancy between 37 and 42 weeks, that baby's head down, that you have no other complications that would cause us concern during your labour or birth. And if If you are a low-risk person, that's not a problem at all. If not, if you're maybe in a higher risk category, you talk to your community midwife, and if she thought it was if she thought it was suitable, she may refer you to myself or Emily to talk about your plans further. But you don't have to let us know that you're coming here, other than we ask you to phone when you're in labour. So it's good to have had the conversation with your community midwife beforehand, so that she can, what we don't want you to do is have perhaps some risk factors, and when you phone up to say, I think I'm in labour, the midwife says, well, actually, you don't meet the criteria for here. So it's much better for us to explore that in pregnancy rather than explore it at the time that you're in labour. But otherwise, you phone the Spire's number. If everybody says yes, it's a good place for you to birth your baby. You phone the Spire's number, and there will be somebody to triage you, to talk to you about when's the best time for you to come in, or whether you could stay at home a little bit longer. But they will absolutely spend time talking to you on the phone and find the best way forwards for you. Gemma, you're saying, are midwives happy to use cord ties on the Spires? I think, Gemma, midwives are happy to use cord ties wherever you have your baby. We just need to make sure that obviously we have secured the blood vessels in the cord and that you're not at risk of bleeding. So it may be that when the cord ties are on, that we have the clamp on initially, and then we can release that when those blood vessels have stopped. Because what we don't want to do is put your baby at risk of bleeding. So we can certainly talk that through with the midwife when you come in, but that should be the same wherever you have your baby. So Siobhan, you've said, following the new induction changes mentioned last week, is the leaflet available to read through? So Siobhan, at present, we're trying to send the leaflet out to women that are actually booked for induction. It has to go through, this process was due to happen in June, July, but we were asked to bring it forwards to enable women the option of having outpatient induction and being able to be out of hospital for longer periods of time. So our print room is running a little bit behind time, and they need to put it in the hospital format and upload it onto our website. So I'm not sure where we are. It's been with them for a little bit of time now, so we just need to make sure that it gets on the website as soon as possible. I will speak to Maternity Voices Partnership and see if there's a way of sharing it on their Facebook page in the interim. But we do make sure that women have it when they come in for their induction of labour, and that they have a chance to read it. But our ideal is to get it to you in advance so that you have time to go through it. So Claire, you're saying our planned elective caesarean section going ahead as normal. Yes, Claire, we're still running our normal service. We ask, the things that have changed are that we are not doing the pre-operative assessments face-to-face. I gather at the minute we're doing those over the phone. But we are looking at our pathways just now to see how we can improve them, because we made lots of changes immediately in response to COVID, and as this become a stable state of affairs now with no massive changes being made, we're now looking at all our pathways to see how we can improve them from the changes that we had to make at the time. So Zoe, Amy, I spoke with you on the phone at the end of the month. Thank you. I'm glad I was helpful and reassuring. You're just wondering when you'd receive the details through. So Zoe, Amy, I did write your letter, and it should come through to you on the in the post. So if you haven't had it within the week, could you contact your community midwife, because she will be able to, when she sees you, hopefully print it off and give a copy to you, and I will have a look from my end to make sure that it's gone through properly. And you said there were one or two things you'd like to discuss. How can I contact you? So I think when you get my letter, which hopefully you will get as soon as possible, you'll have my contact details on it, my email and my phone number. And hopefully we can get in touch that way. If you haven't had anything by Thursday this week, so Amy, if you message via Maternity Voices Partnership, then I can privately send you the details. So Emily, you're 41 weeks today and you've been referred for induction. When will I get my date? So Emily, depending on when your midwife referred you for induction, we generally have somebody Monday to Friday booking dates and getting in touch. So I presume somebody will be in touch with you soon. We aim to induce you when you're 42 weeks pregnant. So that would be next Monday. So hopefully somebody will be in touch in the next day or two to go through that with you. So Carly, you've said, should you be self-isolating before the birth, and if so, for how long? Or is social distancing okay at a low level? So Carly, we have a connection. Hope I'm back. It said I had a poor connection. But we appreciate that some people are still working up until quite late, especially if they're in essential roles. And so, it is important to adopt social distancing as much as possible, and being more stringent in that compared to some of the people that have been out sunbathing and on grasslands and things over the bank holiday weekend. So please do, where possible, get somebody else to go and do the supermarket shopping for you, and make sure that you are more than 2 meters away from someone. Karina, you're saying the consultant midwives at the John Radcliffe, the consultant appointments at the John Radcliffe still going ahead. You've got one booked for the 29th. Karina, appointments are going ahead. Some of the appointments are face-to-face and some have to be via telephone. If it is via telephone, somebody will be in touch with you to arrange that. Otherwise, it would be a face-to-face appointment. But if you have a consultant appointment, there should be a phone number on the letter, and you could call them to find out more details then, whether it's face-to-face or a phone. So Maisie, you've asked if midwifery-led units can help with interventions if a mum's having difficulty. And so my answer to that, Maisie, is we can respond to most things that can happen in a hospital in a midwifery-led unit. The difference in midwifery-led units is we're in everywhere you give birth to a baby, we're constantly assessing you throughout the labour to make sure that you and the baby are well. If we felt like you were developing a problem, or we just didn't feel things were going quite according to plan, we would rather transfer you in sooner rather than later from a midwifery-led unit. So in most cases, you can tell that something's going to happen before it happens, and you can refer into the right place. And I think it's really important to note, Maisie, that it is as safe for you to have your baby in a midwifery-led unit outside the hospital, a midwifery-led unit in the hospital, or on the John Radcliffe delivery suite. So from the baby's aspect, it is as safe as long as it's a low-risk pregnancy wherever you have your baby. In terms of interventions, the thing we know is that mums are less likely to need forceps or caesarean sections if they plan to give birth outside of hospital compared to having your baby on a delivery suite. So from a mum's perspective, it's much better for you, if you are low risk, to plan to birth in a midwifery-led unit. Oh, I don't know what I've done there. So I hope that answers your question. And Maisie, also to reassure you, our 36-week scan is an amazing scan for being able to tell us how the placenta is working. So that's the main reason we do it. We're looking to see, is the placenta still functioning the way it should be functioning? And it's also a great way for us to know if your baby's in the right position and is head down or not. In terms of the estimated fetal weighted baby, we do tend to overestimate in 30% of cases. So please don't be concerned about the weight of your baby. Generally, you grow the right size of baby for you. And the reasons that you don't grow the right size of baby are if you develop something called gestational diabetes, which means that the baby's getting too much sugar and so can grow bigger. And so we screen for that if we think your baby might be a bit bigger, just to make sure that isn't the case. But it is much more accurate, the 36-week scan, for babies that are smaller or who are not growing as well. But for babies who are sort of normally size or a bit bigger, it's not as good as the size. So please be reassured, if you haven't got gestational diabetes, you're growing the right size of baby for you. So Karina, I think I've answered your question. So Maisie, you're saying, wondering if I should become using signal again. Maisie, I don't know if this is your first or second baby. If your first baby was born by forceps, the chance of you needing to have forceps for your second and subsequent baby is so much less. It is very small. And so being at the Cotswold maternity unit can be a really good and positive place for you to have a baby. But please don't think because you needed forceps first time round that that's how you're going to need help to deliver your baby. You know, honestly, if we don't think things are progressing very well, we will transfer you sooner rather than later. And actually, the majority of people second time round go into labour. It's so much shorter than first time round, and they birth their baby very quickly without needing any help. But please do talk to your midwives. There's amazing midwives out of the Cotswold maternity unit. Well, I think they're all amazing. You know, do talk to them, and also have a look at our films on our maternity website page, because we did do a film that was filmed, quite a lot of the stuff was filmed in the Cotswold maternity unit as well, and hopefully that'll answer some more of your questions. So Yvonne, you've asked, is mechanical induction now a pathway that can be used in conjunction with VBAC? Yes, it's a very positive way to induce people if they've had a caesarean section. Again, it would come down to having the conversation about the benefits and the risks of having a vaginal birth after caesarean section, which you probably discuss with your midwife during pregnancy, and then actually then looking at how those are affected by inducing labour. Because when you induce labour, when somebody's has caesarean section before, there's slightly less chance of success and a little bit more risk to your scar. So if you want to choose to be induced, absolutely you can choose to be induced, but we just want to have a chat to you about those, the benefits and risks of both. Okay, so Rosanna, you've got a planned caesarean section booked in a couple of weeks. Do you know if you're able to dim any lights at your head end? Also, how long is the maximum time you can have delayed cord clamping? So Rosanna, our theatres are not really equipped for dimming of lights where you have your planned caesarean section. The lights are quite bright because it's very important that the surgeon can see the vessels and make sure that they minimise your blood flow as much as possible. We appreciate that it would be nice to have a more soft environment for your baby to be born in, but we have to keep you as safe as possible. We do as much as we can to make it a positive experience for you. We tend to, the leads that are generally across your chest that monitor your heart rate, etc., they can go on your back so that they're not they're not on the front when baby comes skin to skin with you. In terms of delayed cord clamping, we do it for at least a minute, and the majority of blood flow has actually flown between the baby and the placenta. It has sorted itself out by 1 to 2 minutes, but we have to balance doing the delayed cord clamping with trying to minimise the blood loss that you lose at caesarean section. Because obviously those vessels have been opened up to do the caesarean section and they will continue to bleed. We try to minimise that as much as possible. So our balance is making sure baby gets the right amount of blood that it needs versus keeping the right amount of blood in your system so that you're well and able to look after your baby. So I hope that answers your question. So Jess, you want me to confirm the new induction changes? So Jess, the pathway is that if you were given a date, say you were given the date of the 15th of May for your induction of labour, we invite you to come into hospital on the 14th of May, the day before. We do monitoring of baby's heart rate, we check you over, check your temperature, your pulse and blood pressure, have a feel of baby. And then we examine you to work out how dilated your cervix is. Now, if your cervix is less than 3 centimetres dilated, our proposal is that we put a catheter into your cervix. What we do is once it's in place, we fill up a balloon. It's got about 30 mils of water in the balloon, and that balloon just causes some gentle pressure inside that encourages the cervix to shorten, soften and open. And that's all the sort of warm-up stuff that early labour does when you're having your baby. If your cervix is more than 3 centimetres dilated, for a stretch and sweep examination, and then we discharge you home to come back on the 15th of May, which was your planned date to be induced. If your cervix is less than 3 centimetres and we put the catheter in, if you meet the criteria to go home, then you can go home that day and return the following day for the next part of your induction. Or if you're meant to stay as an inpatient, you would then stay in the hospital that day. So that's the main kind of changes. The reason for doing this, it is a much gentler way of inducing baby. It doesn't use hormones, so actually babies like it better. Sometimes when we use the Prostin gel, which is the other way to induce your labour, by that we push some gel into your vagina, which again is doing the shortening and softening of your cervix, but it's doing it with hormones rather than mechanically. Sometimes that causes you to get quite a lot of contractions in your tummy quite quickly, and babies don't always like it quite so much. So what we're trying to do is offer a much more gentler way for women to go into labour, that women feel positive about. And obviously, if we put the catheter in and you were suitable for outpatient induction and went home, you'd only be in hospital for hopefully less than 2 hours to have the catheter put in. And if you went into labour before you were due to come back the next day, you could still go to the Cotswold maternity unit or have your home birth or whatever you plan to birth your baby. So it just offers you a bit more choice in terms of what happens. We think it's a good thing because we think it's gentler. It's us advancing practice, trying to listen to what people have said before in terms of, people tell lots of horror stories about induction, and we're trying to address things and make it a more positive experience for people. So I hope that describes it to you. If you didn't go into labour within 24 hours, on the day, the 15th, that you'd be due, that was your actual planned date of induction, we would bring you back in. If the catheter hasn't fallen out, we would remove it, and then we'd be able to break your waters and then progress with the rest of the induction. So we'd get you up and walking about for a couple of hours and seeing whether the contractions came on their own, or else we'd go to delivery suite to give you a hormone drip to bring on the rest of the contractions from there. So I hope that answers some of your questions. Sean, you've asked, if you have a rough birth plan, do we need to let your midwife know before labour, or do we just let you know when we call? So Sean, I hope people have had the opportunity to download the Mum and Baby app. So this is a great app on your mobile phone which enables you to fill in a birth plan. And we encourage the community midwives to talk through that with you, and when you come in we would ask you whether you had that birth plan or whether you have your own written birth plan. It's always good to talk about your birth plan before you come in labour with your community midwives, because you might suggest things that the midwife's not sure whether we can support or not, so it's a good chance to explore that before you're in labour. And otherwise, we would always ask about your birth plan when you come in to have your baby. Sometimes people's labour is happening so quickly when they come in that we don't have a chance to read the plan, and then we would be looking to your birth partner to say, what are the key bits of the plan that we need to try and meet for you? Because we don't want to try and encourage you into a pool if you don't like water and you don't want to be in the pool. You know, those kind of things. If you don't want your partner in the room, these are some things people write, or they don't want student midwives. We wouldn't want you to be met at the door with a student midwife when clearly you didn't want to have one look after you. So it's things like that, that it would be good to prime your partner about what are the key things, just in case your labour is too quick for us to be able to read your plan. So Gemma, you're saying you're considering a home birth, but your placenta is at the front. Would this increase the chance of complications? And if so, would you be better to have your baby in hospital? So Gemma, in terms of your placenta being at the front, the most important thing is that your placenta isn't low-lying and covering the opening to the cervix, because that can put you at risk of bleeding. You can still, with your placenta being at the front, as long as it's high and away from your cervix, you still can have a home birth. But absolutely talk to your community midwife about it to make sure that there's nothing else that because I can't see your clinical record to know if there's anything else in your pregnancy. But your community midwives are a fantastic resource. And if they're not sure, they will ask Emily or I. And if we're not sure, we'll ask somebody else. So it is important that we give you the information to make the right choices for you. So Maisie, you're keen to go to Chippy, but you're getting panicky about how big this baby could be. I think, Maisie, that is a common thing for women to be anxious about. Everybody's concerned about having a big baby, but please don't be concerned. As long as you don't have gestational diabetes, you will grow the right size of baby for you. So, you know, the staff there are incredibly well trained and will support you with birthing your baby. So I think Chippy is a great option for you, as long as there's nothing else that I don't know about. But talk to your community midwife about it. So Kerry, at 30 weeks, you were told your baby's breech and your placenta quite low. You have another scan in May. If this is the case, would it result in a caesarean section, or would they try to turn the baby? So there are quite a proportion of women who have a low-lying placenta on their earlier scan, and as the bottom, the lower segment of the uterus grows into the third trimester, that placenta gives the appearance of having moved. It hasn't moved, it's just that the bit of uterus that it was joined up to has moved and grown underneath it. But if the placenta has moved out of the way, then of course you can have a vaginal birth. If the placenta is low-lying and is covering the opening to the cervix, then we would recommend a caesarean section because it's safer for you and the baby. In terms of baby being breech, again, almost a third of babies are breech at that point in your pregnancy, and actually by the time you get to 36 weeks, it's only 3 to 4% of babies. So if your placenta is not low-lying and the baby is breech, we will refer you to our breech clinic to talk about whether we can turn the baby or not. But obviously, if your placenta is low-lying and baby is breech, then the caesarean section is indicated because of the low-lying placenta. So a lot can change in that period of time. So again, it's just waiting till that 36-week appointment to see what's going on with you. So Debbie, you're asking how the glucose tolerance tests are working at the minute. You're due to have the one blood test on Thursday instead of the full 3-hour test, but you've seen women saying that their first test was fine. Oh, sorry, don't know what I keep doing to this tablet. And it was only after they had a drink that their test showed that they had gestational diabetes. So Debbie, what we're doing is we're actually looking at, there's a test that you can do called an HbA1c, and what it does is it looks at how your blood glucose levels have been over a longer period of time. So it tells us how your levels are. So we're using that test at present instead, and that's found to be an acceptable moving forwards. So please don't be concerned. We are still going to be monitoring you to make sure that we pick up gestational diabetes. It's just a different test. And I'm not sure whether we're looking at pathways just now to see whether there are some pathways we should continue after COVID. And I don't know if that's one of them or not. But my colleague Emily Brace, the other consultant midwife, has been leading on that bit, while I've been leading on more of the labour intrapartum care. So more information will follow, but please be reassured that we are monitoring in the right way to pick up gestational diabetes. So Lucy, you're saying, can you be induced after 2 previous caesareans but have had VBAC since? I think, Lucy, I'd say if you had vaginal birth after caesareans before, and it sounds like 1 or 2, were you induced for those? I think it's trying to look at your whole history in terms of where we go moving forwards. And I'm sure your consultant will talk to you about that. I mean, if you've had 1 or 2 vaginal births after caesarean section and you'd had 2 caesareans and then vaginal births, then it's about looking at how we can best support you. But everything is a choice made on a balance of benefits and risks, and we hope to enable most women to make that choice. You will be under consultant-led care, I presume, because you've had 2 previous caesareans before, so do talk to your consultant about it. So Laura, your point is, after hearing the new guidance asking people whose work cannot be done from home to return to the workplace, you're wondering if there's any prospect that your guideline will change to allow doulas to practice with their clients in homes and hospitals. We will wait and receive guidance from that. But we need to be able to devour the 50 pages or whatever that Boris Johnson has put together, and it won't obviously cover every eventuality. At present, we are still saying just 1 birth partner. We encouraging people to use their doulas via FaceTime, WhatsApp, Messenger, however they want to, so that their doulas are still present. I think you have to appreciate that the midwives are quite anxious, like other people are, about the amount of people that they have to come in contact with, and what we're trying to do is keep everybody safe. So it's not just 1 more person there. If everybody starts to have 1 more person, that's a lot of exposure from midwives. Some of our midwives work in teams where their teammates have had COVID and have had it quite seriously and have taken some time to recover, and that has made them increasingly anxious. And, we want to try and keep as many people safe as possible. And I think the thing with having a doula at birth is it's very difficult for you to maintain social distancing, because a doula is there really to offer support close to a woman, and massage and coping strategies, encouraging words, all of that positivity, that actually it's then very difficult for the midwife to stay 2 meters away, because actually those are her roles, or his or her roles as well. So I think it's very difficult to maintain that social distancing, and certainly that was a key message of Boris's speech yesterday, was about, if you are going out socially, you're going out more, you need to make sure that it's all within the same household. If you go and play golf, then it has to just be those in the same household. So I think, the doula is not part of your same household, so it does make it quite difficult. So I don't see at present that we're going to make any changes with regard to that. So we do think the doula has built up great relationships with women. We're just asking them to use social media to be able to provide that support alongside the midwife. But we have to try and keep everybody as safe as possible. So Caris, you're asking, are partners still not allowed to come to scans with us? Caris, I'm really sorry, but at present we haven't changed that. We're still looking for how we can change pathways, how we can make them more positive for women. And you know, we appreciate it's really difficult. It's so exciting for you having babies and going for your scans, and we're terribly sorry that partners can't come with you just now. I promise as soon as we can make these changes to the pathways, we will do. But again, that comes down to the exposure to our scan staff of more and more people. Because if you do 40 scans in a day and everybody brings a partner, that's 80 people they're exposed to. So it is a lot of people. So we need to keep our staff as well as possible, and we have to appreciate that some of our staff are a lot more anxious than others. Some have underlying healthcare problems, some have families with underlying healthcare problems, and so everybody's trying to keep as safe as they can. So we appreciate that it is so difficult for everyone just now, and we are doing everything we can to be able to still run a full maternity service. Leanne, you're saying, can you have a home birth without a birthing pool because you're not sure you have room for one? Absolutely, Leanne. You know, you can use whatever positions you want to help you. Sofas are really good for leaning over, beds, chairs, anything like that. What we don't advise, Leanne, is for you to use your bath at home, and the reason for that is your bath is too narrow for you to be able to open up your legs wide enough to have the baby, and also it's not deep enough really to secure to make sure that that baby is born completely submerged in water. So it's really important for us that if you are birthing at home, you absolutely don't need a pool, but please don't use your bath as a backup. So Amy, you're almost 20 weeks and you've been suffering from pelvic girdle pain, and you're wondering what you could do to help because it's pretty painful. Amy, pelvic girdle pain is an awful thing for pregnant women to have to experience. Amy, it's because that joint at the front of your pelvis is not fixed. The ligaments have some movement in it and your pelvis is becoming out of line. So it's very important for you to think about how you carry things. I don't know if you have another child, but quite often if we have another child, we balance it on one hip or another, which offsets your pelvis. Some women carry about the most amazingly heavy handbags. And again, if you have a heavy weight on one side, you're bringing your pelvis out of alignment on the other side. So we ask you to look at trying to minimize what you carry in terms of children or heavy bags. In terms of your pelvis, is trying to make sure that you don't do any movements that cause your legs to open out the way. So that when you sit into a car, try and sit down your bottom first and move your legs together into the car. Same, bring them out together before you stand up so that you're not opening your legs wide. The same applies to getting into bed. When you get into bed, sit onto the bed, move over to the side and lift your legs together up and into the bed. And if you're struggling, perhaps a partner can help you with that movement. A pillow between your legs so that your legs aren't completely flopped in together, because you want to just keep your hips in natural alignment. So anything that causes your hips to come out of alignment or the weight on your body to be more one side or another will adversely affect your pelvic girdle pain. You can take paracetamol for your pelvic girdle pain if you feel it's more painful. When you wake up in the morning, then you could have some paracetamol when you wake up before you get up out of bed. But you can take paracetamol safely in pregnancy. And some women experience quite severe pelvic girdle pain and need some more support, and you can take some stronger medication. But start with just changing the way you carry yourself and the things round about you before starting to take drugs more regularly. So I am sorry, pelvic girdle pain is a horrible thing. There is, I think there's still the Pelvic Partnership. If you Google them, then they will have more information and support as well. So Rosanna, you said you'll be self-isolating before the caesarean section on the 27th. You have your 39-week midwife appointment at the GP surgery 6 weeks before. Would you advise me to still go? So yeah, I mean, if you haven't, it depends when you last had an antenatal checkup. But generally, if you're having your caesarean section in the same week, I don't think you need to go to your antenatal appointment with your midwife. You said that the reason you're having the caesarean section is because the baby's breech. You're saying, will you be scanned before the caesarean section date to make sure it's still breech? Okay, so what happens is, when you've had, when you're having a caesarean section because your baby's breech, they will do a scan on the morning of the operation. If the baby is head down, then they will let you go home and continue with your plan for a vaginal birth. If the baby is still breech, they do the caesarean section. And some women in the past have said, okay, I don't care that my baby's head down. I want to still have the caesarean section, but we wouldn't be able to do that caesarean section because it wouldn't be clinically indicated anymore. And generally it's better for women to go home and wait for spontaneous labour. I hope that helps. Nikki, you're saying, do birth partners need to isolate before you plan caesarean section 2? And Nikki, we're advising people to isolate as much as possible before they access maternity services. But if your partner is an essential worker and he's needed in his job, then as long as he applies social distancing rules, then that is okay. So Sean, you said, is there a certain length of time our birth partners have to leave after baby arrives? And you've basically been told in Chippy Dad was made to leave straight away. The thing with where you have your baby depends on what else is happening. I mean, the likes of in the Spires midwifery-led unit, you tend to be in the birth room 1 to 2 hours after the birth. By the time we get all the paperwork done, you've fed your baby, you've had some tea and toast. Like I said, unless we rush you out because we need the room for somebody else, your birth partner stays with you. And it's only when you're transferred to the postnatal bed that we encourage you to go home. In terms of Cotswold maternity unit, I can't really comment on the dad that was basically told to go home straight away. Because the Cotswold maternity unit doesn't have an overnight staying facility, so so generally partners stay with the women and then go home, as a group together. I suppose the difference may be if they birthed during the day and there are antenatal clinics happening at the Cotswold maternity unit, a partner may be asked to go home to reduce the exposure to other pregnant women that are coming in for their antenatal checks. So we're trying to keep partners together with mum and baby for at least an hour or two after the birth. But I suppose on occasion, like the Cotswold maternity unit, because antenatal women are coming in during the day, they might be encouraged to go home sooner. But we appreciate these changes that people are having to make, and we're trying desperately not to separate mum and baby and partner as much as we can. We just obviously can't afford to put anybody else at risk. So we have to think about the risk to other people as well. And that's one of the reasons that we couldn't continue offering birth at Wantage, was because it's quite a tight corridor. There are people coming in for antenatal checks and there wasn't an ensuite bathroom to enable people to use that. So, we are trying to respond in terms of the services that were offered to still be able to offer choice to women in terms of midwifery-led units and home birth, but we obviously have to minimise the contact that women, their partners, other women, staff come into to be able to provide a full spectrum of care. So Vicky, you saying, can the whooping cough vaccine be given IV or does it be IM? I'm afraid it is by a muscular injection, Vicky. I'm sorry if you have problems with IM injections, but it's definitely an IM injection that you get it with. That's the safest way to deliver the vaccine. Polly, you've asked, can partners attend scans? I'm afraid, Polly, just now partners can't attend scans, and I don't see that that's going to change in the short term. Lisa, you're saying, what is the most important thing your midwife will look for on your birth plan? Haven't done mine yet and I've seen so much detail, and others with not much. I think, Lisa, it's just things that are important. Or if you're hypnobirthing, it's really important that you write that you're hypnobirthing, and if you have any key words and terms, because different hypnobirthing packages adopt different words. So I think that's really important. If you don't like people touching you, in terms of, stroking your arm and soothing you, some people don't like being touched and other people do, then that would be helpful to know, because instinctively as a midwife, we come round to talk to you and we may place a hand on your shoulder. If you don't like things like that, then these are the kind of things I think are really important. If you, in terms of pain relief in labour, if you went, I don't want to be offered anything, if I want it, I will ask you. If you write that in your plan, a lot of midwives won't offer pain relief as a standard. That's to do with a woman's psyche, because, when you're in labour and you're coping, if I offered you pain relief, a woman's mind works as such that she said, oh, I think I was doing all right, but if Wendy's asking if I want pain relief, maybe I'd better have it, because maybe she knows that something else is coming. So it's a kind of negative thing for a woman. So we tend to say to people, we won't offer you pain relief. If you want it, please ask us. It's not that we're not going to give you it, it's just that we're doing that positivity over helping you cope. So if there's things like that you think are important, trying to think of other examples. If you've made up your mind, say 100% that you're not going to breastfeed, it's really important for us to know that, because instinctively we would put a baby skin to skin so that baby can nuzzle and smell at the breast. Now, even if you don't want to breastfeed, that can still be a really good thing to do, because it helps to regulate baby's temperature, their heart rate, their breathing. And it helps with bonding. So it isn't just about feeding, but it's trying to think through those things. Some people don't want to have student midwives, some people don't want to have medical students. It's not such a big thing at the minute because we aren't having the medical students coming through. But it is, things like that you feel are really important. Say your name was Maria Louisa, but actually you just like to be called Lou, then please write that for us so that we know, because we don't want to be calling you Maria Louisa if you just want us to call you Lou. So things like that. I think generally delayed cord clamping, skin-to-skin contact are things we kind of do as standard. So that's why some people want to write down lots of things and some people just want to write down a few things, and some people choose not to write anything, and that's completely fine. We're not going to treat you any differently. We're going to do everything we can to support you, because that's our job. But it's really up to you how much you want to write. But it'd be worth going into the App Store and downloading the Mum and Baby app, because that might give you some ideas about the kind of things people think about for their birth plan. And you can start filling in your app. Oh, thank you all much for your very positive messages. Sophie, you've asked, have there been many COVID positive mothers giving birth at the GR, and how's the hospital segregating suspected or confirmed cases in maternity? So Sophie, we have a pathway where we screen women on the phone, and if we think that if women tell us that they have symptoms, we ask them to attend the maternity assessment unit but not enter the building, and they call us when they're there, and we go meet them in gowns and we give them a mask and we take them to some allocated rooms on the delivery suite where we look after them. We've reduced the footfall in maternity so that the midwives aren't coming in and out of the room too often, and the midwives are all wearing full PPE. And then when the baby is born, if possible, the women will go home again with her partner. If not, they come up to level 7. We have an area of postnatal beds where, because we have ensuite rooms there, that women can stay there, and we have all the what we call donning and doffing areas for PPE, so areas where we can put on the right equipment to protect everyone and then take it off again and to reduce the chance of spread. Any room that a woman has been in and vacates is thoroughly cleaned to make sure that it's safe for the next people that come along. You've asked how many cases we've had. We've had very few indeed. I can't tell you an exact number, but there's really not been very many. I think women have been very good, pregnant women, at self-isolating and social distancing, and so that has been fantastic from our point of view. And I suppose our worry comes when more and more people start going out and about, that's not going to be the case. So we're hoping that people are still very sensible and encouraging their relatives as well, their friends and relatives, to socially distance, because it is important. It's what's helping to keep you all safe. So Caitlin, you didn't have whooping cough during your pregnancy and your baby's now 8 weeks old. Can he have it or doesn't it matter? Caitlin, now I'm not an expert. My children are in their very late teens now, but I'm not sure. I think part of babies' immunisations that they have involves whooping cough. But you know, your GP is the best person to ask for that, your GP surgery. But I think it might be included in the screening that they have in their immunisation stuff. I just wish I could remember. I'm sorry, not my forte, one for a GP. So then we have Sophie. You said, if you're quite unwell after giving birth, for example, you had a big bleed after your first baby, would your partner still have to leave? Last time you felt like a zombie. Oh, I'm sorry. It's hard when you lose so much blood. I'm really sorry, this tablet, oh there, and your partner was clearly very supportive for you. So Sophie, you know, when we know that you and the baby are stable will be the point that your partner would leave. And we are aware of women who need some extra help, and we have enough staff here to support them. I have to say our staffing levels are very good, touch wood, and we hope that you know, we have extra staff about to be able to support people, and women generally. I'm sure there's some women that haven't had as positive an experience, but the majority of women have said that the support that they got on the postnatal ward was very good. We admit that we're not as good as your partners. We're not trying to replace them, but we do want to make sure that you and your baby are well looked after. I hope that answers your question. So Katie, you're saying, what would we be advised to do isolation-wise once baby's here and we're returning home? We've heard some people say if the family isolate for 2 weeks completely, they're safe to visit. Is this true? So Katie, again, it comes back down to following the government's advice. You know, so at present we're not allowed to socialise out with our households, and that would apply for you whether you've had a baby or not. And we just have to watch this space in terms of what steps we follow next from the government's point of view. But they aren't allowing households to mix, which is why it's really important that people only have people that are part of their household in their household. So I know of people who've met their grandchild from the first time through a window, as in they've been standing outside and the mum has been holding the baby up to the window. That's not ideal, and as a budding grandmother at some point, hopefully not for another 10 or so years, you know, again, I would want to cuddle my grandchild too, but it is very important that we don't increase the risk. So I think, you know, my advice in answer to that question is we just have to wait and see what the government say. Because it is all about being exposed to other people, and you want to minimise that risk of infection to you and your family. Antoinette, you said, would you tell me again the app for the birth plan, please? Of course, if you go onto the App Store and download the Mum and Baby app, I'm pretty sure there's a reference to it in our maternity website as well. It was an app that was invented by by London midwives, but we have adapted it for Oxford. So when you type in that Oxford is your nearest place of birth, you will get the information that's relevant to you. We think it's a great app. We had lots of support from Maternity Voices partnership over this app as well, and we'd just like to see more and more people downloading it and using it. Sadly, when we launched it was probably just prior to COVID, and it's got a little bit lost in the interim, but our midwives will be able to tell you if you're not sure, pardon me, how to find it. Okay, so Anne, you're due to be induced tomorrow morning. You'll be 42 weeks exactly, but you haven't been told the induction plan yet. Will you get a gel or drip mechanical? Your waters broke yesterday, but you've had no contractions. Will you just be told the plan tomorrow morning at the induction? So, Anne, you should have been, you should have had your induction plan for tomorrow, which should have meant that you'd have been invited in today to have mechanical induction. However, because your waters are broken, we can't do mechanical induction on you. So I presume, and again, we'd need to check this, and for you, that you have a plan to come in to have the hormone drip to continue with your induction tomorrow, if you haven't had any contractions. So, Anne, if you could separately message via the Maternity Voices partnership, I will follow up on that for you, because I feel you maybe got a little bit lost along the way. So I just want to make sure that we have the plan in place to enable you to have your induction, because you should be induced tomorrow because you're 42 weeks. Thank you, Sean, for helping with the app. So Caitlin, you said your son has a hernia. Is there anything to worry about or anything to watch out for? Again, I think it's one to talk to your GP about, Caitlin. Yeah, generally things resolve, or else we can do things to help with it. So I don't, that's terribly vague, but it's not really my thing, I'm afraid. Gemma, you said, do you still provide the small formula bottles for babies? Yes, we do. Gemma, if you're planning to bottle feed your baby, then yes, we still have the bottles here. Amy, you said you definitely like to breastfeed again this time because it was such a lovely experience. That's great news. Well, guys, I think you probably heard enough of me yabbering on. I am overdue to leave you in peace. So I hope today's been helpful and that we've managed to explore some things. And I gather I will probably be seeing you next week at the same time if you're still there with any questions that you may have. In the interim, please remember that we now have the Ask the Midwife phone line. We had a few teething problems to begin with, which I think happens with anything. So the Ask the Midwife phone line is available every day from 11 a.m. until 7 p.m. And they are there to answer your questions. So if you've got any burning questions before you ask me next week, then please give them a ring. They'd love to hear from you. So I'm really sorry that I'm having to end it here, because I'm sure I could keep answering questions all day, but I have to go and do some other bits and pieces. So thank you all very much, and we will speak to you soon. If I can work out a way to stop it.